not all hospitals in the world are the same. There are medical centers that seem like they're from the future, using AI to help with diagnosis, robotic surgery for more precise operations, and advanced laboratories that can study a person's genes. In this video, we'll find out about some of the most advanced and sophisticated hospitals in the world, and why some of the most difficult and complicated medical cases are brought here. Before we start, please like this video and subscribe. It means a lot to us content creators. Thank you. And now let's begin. Cleveland Clinic. This started in the early 1920s as a small medical practice, but over the decades it has become one of the most advanced hospital systems in the world, especially in heart care, complex surgery, and medical research. According to the rankings of U.S. News and World News, Cleveland Clinic has long been among the top hospitals when it comes to cardiology and heart surgery. But the reason why it is often mentioned in global medical discussions is not just because of its reputation. For example, their electronic medical record systems are interconnected. This means that when a patient is being treated by different specialists, doctors can quickly see imaging scans, laboratory results, treatment history, and prescriptions in one integrated system. This is very important, especially for complex illnesses where many departments need to work together. In cardiovascular medicine, the hospital is known for using advanced cardiac imaging technologies. They use high-resolution CT scans, MRI systems, and hybrid operating rooms that combine surgery and live imaging in one place. They have extensive programs in genomics, regenerative medicine, immunotherapy, and biomedical engineering. According to the hospital's official research programs, their goal is to more quickly convert laboratory discoveries into actual patient treatments once there is enough scientific evidence. AI is used to help analyze imaging scans, detect patterns in radiology, and assess patient risk. But according to medical guidelines and experts themselves, these systems are used only as support tools, not as replacements for doctors. In modern healthcare, having good equipment alone is not enough. The real challenge is how to combine technology, specialists, research, and quick decision-making into a single system. Mayo Clinic has been known for over a century for advanced medicine, research, and collaborative patient care. And from its main campus in Rochester, Minnesota, it has expanded to different parts of the United States, including Arizona and Florida. In many hospitals, patient information is separated depending on the department. But at Mayo Clinic, their digital systems are heavily integrated so physicians can quickly access records, scans, test results, and treatment plans. According to official data from Mayo Clinic laboratories, they process millions of laboratory tests every year. This includes molecular pathology, genomics, and personalized medicine testing. In other words, they don't just look at what illness the patient has. They also try to understand how genetics and biological factors affect a person's actual treatment response. They also widely use robotic-assisted surgery in orthopedics, oncology, and urology. But like other advanced institutions, equipment is not the only reason why they are leading. A big part of it is the research ecosystem. Thousands of active clinical trials are currently being conducted at Mayo Clinic, including studies on cancer treatment, neuroscience, regenerative medicine, and immunology. They also have a Center for Individualized Medicine that focuses on using genetic data to help create more personalized treatment plans. And perhaps that's the reason why Mayo Clinic remains one of the most respected medical institutions in the world. Charité. It is one of the oldest and most respected university hospitals in Europe. Charité. It is one of the oldest and most respected university hospitals in Europe. For many decades, it has been a center for medical research, infectious disease studies, neuroscience, and molecular medicine. In fact, several Nobel Prize winners in medicine have been connected to it throughout its history. The hospital has hundreds of specialized clinics and research institutes focused on complex fields such as oncology, neuroscience, immunology, and infectious diseases. They are also among the top European hospitals. In centers where genomic sequencing and molecular diagnostics are widely used, simply put, they don't just look at the symptoms of the disease. They also examine the actual biological and genetic behavior of the disease to help make more precise treatment decisions. This is especially important in cancer medicine and rare diseases where each patient's response to medication is different. They use advanced MRI systems, PT-CT platforms, and high-resolution scans, and specialized neuroimaging facilities for the brain, cardiovascular disease, and complex neurological disorders. And because their digital systems are interconnected, imaging data can be quickly shared across different departments. This is especially important in stroke care, trauma response, and emergency surgery, where every minute is critical. In some procedures, they use hybrid operating rooms that combine imaging, navigation systems, and surgery in a single environment. According to European medical reports and institutional research programs, some of these facilities are also used for highly controlled experimental procedures and first-in-human clinical applications under strict ethical oversight. Another field where Charité is known is infectious disease research. In Europe, the institution has become an important part in the study of emerging infectious diseases, epidemiology, and public health preparedness. They have specialized isolation units and advanced biosafety laboratories for high-risk pathogens and outbreak response research. They connect electronic health records, imaging systems, and research databases to speed up clinical coordination and scientific analysis. In other words, the strength of Charité does not lie in a single machine or a single breakthrough technology. It lies in its ability to synchronize research, diagnostics, hospital care, and scientific collaboration on a massive scale. Johns Hopkins Hospital. Since the late 1800s, it has been one of the most influential medical institutions in the United States, especially in research-driven healthcare and evidence-based medicine. And up to now, it remains one of the hospitals most frequently visited for the most complicated medical cases. Johns Hopkins Hospital has a strong connection to Johns Hopkins University School of Medicine, which is why scientific research plays a big role in their daily clinical operations. In other words, laboratory research and patient care are not separate. They use high-resolution MRI and CT scanners, advanced interventional radiology suites, and functional neuroimaging technologies for the brain and nervous system. And because their imaging systems are integrated into clinical workflows, surgeons, radiologists, neurologists, and trauma specialists can quickly consult with each other in real time. This is extremely important in stroke response, neurosurgery, and emergency trauma care, where every second can affect the patient's survival and recovery. In surgery, they also widely use minimally invasive and robotic-assisted procedures. Robotic systems are used in urology, thoracic surgery, gynecology, and general surgery to make operations more precise and reduce recovery time. But one of the most important focuses of Johns Hopkins right now is data-driven medicine. They have made significant investments in electronic health records, medical analytics, and clinical informatics to improve patient outcomes. They also have highly specialized care units for cancer treatment, neurological intensive care, transplant medicine, and pediatric specialty programs. Because of this, many patients from different parts of America, and even patients referred from abroad, come here for conditions that are difficult to treat in ordinary hospitals. In the end, the advanced status of Johns Hopkins is not just about the amount of technology, but also its long-standing culture of scientific rigor, research integration, and strict evidence-based standards that have become a model for many modern medical institutions around the world. Karolinska University Hospital. It has a strong connection with the Karolinska Institute, one of the most respected medical universities in the world, and the institution responsible for selecting the Nobel Prize in physiology or medicine. But despite its prestigious reputation, the true strength of Karolinska lies in how it combines biomedical research and actual patient care. One of their biggest focuses now is precision medicine. In traditional healthcare systems, the treatment approach is often the same for many patients. But in precision medicine, they try to adjust the treatment based on the person's genetic profile, biomarkers, and biological characteristics. This is what Karolinska became known for. They have made significant investments in genomic diagnostics, molecular pathology, and advanced biomarker testing for rare diseases, inflammatory disorders, neurological conditions, and complicated cancer cases. In other words, they're trying to better understand how diseases work at the level of genes and cells, not just the symptoms. When there is enough scientific evidence, genetic sequencing and molecular profiling are used as part of the clinical workflow to help with more accurate diagnosis and treatment planning. In surgery, Karolinska is also among the European hospitals that widely use robotic-assisted systems. Because of this setup, there are operations that used to require open surgery that can now be done using smaller incisions and with faster recovery time. Their healthcare infrastructure is also digitally integrated. Electronic health records, imaging systems, laboratory databases, and patient monitoring platforms are interconnected across the different campuses of the hospital. Because of this, specialists and researchers can coordinate more quickly in managing complex complications. Many patients from other parts of Sweden and neighboring countries are transferred here when highly specialized expertise that is not available in local hospitals is needed. In the end, it's not just the size of the facility that makes Karolinska advanced, but its ability to make scientific innovation part of actual patient care in day-to-day clinical practice. Samsung Medical Center, it was opened in 1994 and is connected to Sungkyunkwan University School of Medicine. Since then, the direction of the hospital has been clear: to combine advanced medical care and high-level digital systems in a single integrated environment. One of the biggest strengths of Samsung Medical Center is its digital infrastructure. Electronic medical records, imaging systems, laboratory data, and patient monitoring platforms are all interconnected throughout the hospital. In other words, clinicians can quickly see the condition of the patient in real time, including scans, medications, laboratory findings, and treatment updates. They also have automated medication dispensing systems and centralized monitoring centers to help with patient safety and operational efficiency. Samsung Medical Center is also active in clinical trials and medical research collaborations with universities and industry partners. Their main research areas include cancer therapy, neuroscience, cardiovascular disease, and transplant cardiology.
Vascular disease at transplant med.
After the major infectious disease outbreaks in South Korea in recent years, including the MERS outbreak, Samsung Medical Center is one of the hospitals that upgraded its facilities to improve outbreak preparedness. This includes negative pressure isolation rooms, advanced ventilation systems, and centralized infection monitoring. This showed how modern hospitals are changing. They're not just for treating illnesses, but also for dealing with major public health threats. Singapore General Hospital, this is the oldest hospital in Singapore. It started back in the early 1800s. But despite its age, it is now one of the most modern tertiary referral hospitals in Asia. It also has a strong connection with Duke NUS Medical School and Singapore's national research infrastructure. That's why research and medical innovation play a big role in its operations. SGH mainly handles the most complex cases, including advanced cancer, cardiology, neurology, trauma, organ transplants, and infectious diseases. Many of the patients here come from other hospitals in Singapore or from neighboring countries who need more specialized treatment. For diagnostics and imaging, they use a high-field MRI system, advanced CT scanners, PT-CT imaging, and specialized neuroimaging and cardiovascular facilities. At SGH, imaging results, laboratory findings, and patient records are integrated into their electronic medical systems. Because of this, different specialists can quickly coordinate during time-critical emergencies such as stroke, severe trauma, or acute cardiac events. In surgery, they widely use minimally invasive and robotic-assisted procedures. They also have hybrid operating theaters that combine live imaging and surgery for more complex vascular, cardiac, and oncological interventions. SGH is also active in clinical research. It is involved in many studies and collaborations on cancer, infectious diseases, and translational medicine. This is a field focused on translating validated laboratory discoveries into actual patient care. And when it comes to infectious disease management, the hospital has also played an important role in outbreak response and highly monitored isolation systems. This became even more important after various regional outbreaks in Asia in recent decades. Sheba Medical Center. It is located near Tel Aviv and is considered the largest hospital in Israel. It is also one of the country's main national referral centers for highly specialized medical care. One of the reasons why Sheba is well known is its extensive use of interconnected digital systems. And because Israel's technology sector is strong, many projects at Sheba are also connected to the development and clinical testing of new medical devices and healthcare systems. But one of the most important aspects of Sheba Medical Center is its emergency preparedness infrastructure. Because of regional security risks in the Middle East, the hospital puts a lot of focus on its ability to continue operations, even during mass casualty events or major emergencies. They have backup power systems, reinforced facilities, advanced ventilation infrastructure, and rapid triage technologies to keep the hospital systems operational during times of crisis. This shows how modern hospitals are changing, not just as treatment centers, but also as critical national infrastructure. And in the case of Sheba, it's clear that its reputation is not just because of branding or publicity. It comes from long-term investment in technology, research, emergency systems, and highly specialized care. University of Tokyo Hospital. As the main teaching hospital of the University of Tokyo Faculty of Medicine, it plays a major role in shaping medical education, research, and clinical standards throughout the country. It also handles many of the most complicated cases. These are some of the ones. One of the greatest strengths of the hospital is its connection to scientific research. When there are new validated discoveries from Japan's medical research sector, they are tested more quickly in clinical trials and treatment development within the hospital system. And the University of Tokyo Hospital is also one of the leaders in precision medicine in Japan. When supported by scientific research, genomic testing, molecular diagnostics, and biomarker analysis are used as part of treatment planning for cancer, inherited disorders, and rare diseases. It is also a major referral center for transplant medicine, advanced oncology, and cardiovascular care. Many procedures done here cannot be performed by smaller regional hospitals because of the high level of specialization and technical requirements. And perhaps that is the real reason why the University of Tokyo Hospital is among the most advanced medical institutions in the world, not just because of a single famous innovation, but because of the systematic way they develop, test, and use advanced medicine on a massive scale.